Hello, everyone. Welcome back to my YouTube channel. This is Admission Tips with Weezy. And if you are watching this, I'd like to congratulate you for how far you've come. We are going to talk about the most important aspect of the admission process and the last aspect of the admission process. I call it the most important aspect of the admission process because this is the point where your confidence level is being put to test. This is the point where your honesty level is being put to test. This is a point where you either be given the admission or be let go. So we are going to talk about so many things concerning the interview. Now, we are going to talk about how to dress for the interview. We are also going to talk about how to build your confidence level in the interview room. We are also going to talk about some of the sample questions that might come and how to tackle those questions. These are things that we are going to talk about in this particular video. So let's keep the ball rolling. Now, how do you dress when you're coming for the interview? First of all, if you're a guy or if you're a male, you should come in your suit. If you do not have suit, just wear your long sleeve with your trousers, and then you come in with your shoe and your belt. Normally, you match your shoe with your belt. So black shoe goes with black belt, and then brown shoe goes with brown belt. Make sure you are looking sharp. That is for the male. And for the female, when you are coming, you can be in your suit if you have one, or you can be in any corporate attire at all. You can also be in your African print if you choose to. Yes, that is how the lady should look like. It should look very decent for the interview. Now, how to build your confidence level in the interview room? What are some of the things to do when you get to the interview room for you not to be shaking, for you not to be worried about what to say and all of this stuff? That is what we are going to talk about now. First of all, you need to put it in your mind that this interview is going to take just like 10 to 15 minutes. You are not going to spend the whole day in the interview room. So just put it in your mind that no matter what, I am going to go through this. Within 10 to 15 minutes, I am done. And you've been preparing for this for a very long time. So this is something that you can use this 10 to 15 minutes to deliver and you go away. So this is what you should put in your mind. Secondly, your first line of confidence come from what you wear. That is why I'm telling you that when you are coming, make sure you come in very decent. So when you come in with your attire that I mentioned early on, you'll be looking good, and then that can build your confidence level when you get into the interview room. Now, make sure you know how to practice the breathing method, okay? The breathe in and breathe out method. Whenever you are feeling so anxious, you try the breathe in and breathe out method. In fact, immediately before you enter the interview room, try to do the breathe in and then the breathe out method, and then you will feel some kind of relief before entering that room. Now, when you are asked a question, okay, when you are asked a question, you need to take your time before answering the question. Do not be in a hurry to answer any question at all. In fact, they are there because of you, and you just have to feel relaxed and give out your answer. So when you are asked a question, take a second, take 2 seconds, organize your thoughts, and come in with a perfect answer. That is what they expect you to do. Nobody is expecting you to be in a hurry and then end up not giving a perfect answer. So, yes, put that in your mind. Relax when you get there and give out a good answer. In fact, you need to sit upright. Sit upright. The truth is, you don't have to sit with your hands in between your thighs. No, it is it is something that will reduce your confidence level. In fact, a slight hand movement is allowed. As you are talking, you are moving your hands around a bit. This will help you to reduce that anxiousness in you. It will reduce that kind of anxiety in you. So you can move your hand around uh, small, small. These will boost your confidence level. If you do not want to move your hand around, you can fix your hand into each other like this and put it on your thigh like this. This will help you to maintain your confidence level when you go into the room. Now, I will also advise you to pay much attention to the questions. Pay much attention to the question. In fact, remember that understanding the question is also part of the answer, right? So make sure you pay much attention to the question. When you do not hear a question that a panelist asks, you tell the panelist to give you the question again or to repeat the question. It is allowed anywhere. It is allowed during interview. There might be situation where you will not hear the the interviewer asking you the question. So what you have to do is to tell the interviewer to repeat the question that he just asked you. It is allowed. But one thing you need to know about this is that you do not have to do this too many times. So you can do this like once or twice. Because when you try doing this for more than twice, thrice, and it's becoming too much, it will portray you as someone who doesn't listen or someone who doesn't pay attention. So, yes, I would advise that when you don't hear the question, you make sure you tell the interviewer to repeat the question to you. But make sure you don't do that too many times. Now, one thing you need to know also is that when you get to the interview room, there is always one person that gives you that confidence. There is always that person that shares this smile with you. When you get to the interview room, you realize that there is someone that whenever you are talking, whether you are giving a good answer or a bad answer, the person keeps nodding. That person is your savior in the interview room. So what you have to do is anytime you are answering a question, make sure you look at that person most of the time. This will help you boost your confidence level. The truth is, when you get there, you will be meeting like three, four, five panelists. So, when you are talking, as I said, someone who gives you that confidence by nodding his or her head whenever you are talking, you should try looking at that person most of the time. This will help you build your confidence level. Now, as I said, there will be about 3 to 5 panelists, right? These are the people that will be asking you questions. And one person will ask you the question at a time. What you have to do is whenever someone is asking you a question, make sure you are looking at the person. Make sure you listen to the question very well. After that, when you are answering the question, make sure you look at everybody sitting there. Whilst you are answering the question, look at everybody sitting there. In fact, you can decide not to look them into the eyes. You can decide to look at their forehead whenever answering the question. Uh, you shouldn't focus on just the person that asks you the question. You should try looking at everyone sitting on the panel. And especially that particular person that gives you that confidence, that particular person that keeps nodding whenever you're answering a question, you should make sure you look at that person often. This gives you much confidence when you are in the interview room. Now, another thing and very important thing you need to know is that you need to keep your answers short. You need to keep your answers simple. Now, the idea is not for you to come and impress them. They just want to know your view on some situations. So, and some questions need just a simple answer. Some questions don't need you to go too far. So in those questions, when those questions are asked, you don't fumble around by giving them a lot of vocabularies and all of those stuff. In fact, they are not there with dictionaries to be looking out for your vocabularies. So what you have to do is to keep your answers simple, keep your explanations simple, and look out for questions that need a straightforward answer. You give a straightforward answer. Let's say you go in there and you are asked to tell us something about the amalgam war. Amalgam war might be something that you've never heard before. You don't even know what amalgam is. So simply what you have to tell them is that you have no idea about this particular question, but you are very interested in this question. And just after here, you are going to read about this particular amalgam word. There's a perfect answer to something that you don't know. In fact, you don't know, but you haven't told them that you don't know. You've also told them that you have no idea right now, but you are interested in it and then just after the interview, you are going to read about it. This portrays you as someone who is willing to learn. So, yes, I would advise you to give such an answer to things that you have no idea about. Now, let's say they ask you if they ask you to talk about or give your thoughts on abortion. So, what do you think about abortion? This is not something that you tell them that I have no idea, or when I leave here, I'm going to read about it. You know abortion, you know what abortion is. So, this is something that needs you to say something. In fact, they are not expecting you to even get it correctly, but this is your thought. Your thoughts wouldn't be wrong, your thoughts wouldn't be right. You are just saying something concerning the topic that they've asked you to talk about. So, this question needs you to say something. So I want you to know the difference between things that will need you to say just no idea, and things that will need you to say something, even though they don't expect you to say a perfect thing. So these are two examples that I've given you. Now, at this point, if you have not subscribed to my channel, I will plead with you to hit the subscribe button, like the video, and leave a comment below as we continue. Now, what are some of the questions that are likely to be asked during the interview? What are some of the questions that they will expect you to know the answer in the interview room? This is what we are going to talk about at this point. Now, when you get into the interview room, the questions will be grouped into some categories. So the first category will be things about yourself. Okay. They will ask you questions about yourself. Secondly, they will ask you general knowledge questions. Thirdly, they will ask you ethical issue questions, things that you need to know, okay, in the profession, like ethical issues, and then issues concerning the profession in which you are coming into. That is the dentistry and then medicine profession. Now they are going to ask you something concerning your community contribution. So these are things, these are the category of questions that they are going to ask you. Now we are going to tackle this step by step. We are going to tackle this um, category by category. So, without wasting much time, let's just move on to the first one. Now, what are some of the questions that they can ask you about yourself? This is a question that's, or this is something that they will tell everybody to do. When you get in there, they will, you greet them, they will offer you a chair. When you sit down, the first thing they will ask you to do is talk about yourself and your family. The question is talk about yourself and your family. Just in case they don't bring the family, fine, you won't talk about your family. But I'm sure that when you get there, they tell you to talk about yourself and your family. There's a point where you mention your name. There's a point where you tell them about your age, you tell them about your parents, you mention their name, you tell them which born you are, whether you are the first born, you are the last born, you are the fifth born, you are the second born, anything at all. You tell them about how many people are in your nuclear family, just for you to get something to say. Okay. You can also tell them whether your parents are alive or uh, they are not alive. See, this is interview, and then you are allowed to present yourself PT. Whatever you do to gain admission, that is what you are doing. So you tell them, and moreover, you are telling them the truth, right? And in this kind of interview, nobody knows whether you are lying or you are telling the truth. But things about yourself, you do not have to lie. I mean, if you lie about things like that, you will be easily caught. You see, so you should know when to lie and when not to lie. So yes, things about yourself, I will advise you to tell them the truth. Yes, you can also tell them about the work that your parents are also doing. Now, after that, you can talk about your likes and dislikes. You can talk about you should talk about your educational background. That is your primary school, your JHS, your SHS. You should tell them about positions that you held in these schools. Now, I will advise those who are coming from schools that are less endowed schools, okay? When you are coming from such schools, make sure you mention the school. Well, they have your documents around. but it will be very important for you to mention your school. If your school is such low school, it puts you, it gives you some kind of advantage. So I would advise you when it gets there, you mention the school that you attended and some of the positions you held in those schools. Now, when you are stuck and you don't even know what to say, you can tell them that, and now you want to become a medical doctor, or you can tell them that other things or many more will be known about me as this interview proceeds. Then you bring that to an end. This is how you talk about yourself. Yes. So, uh, and remember that whatever you say about yourself, there might be follow up questions. Okay. Let's say you say you love football. Okay. You are someone who loves football. They can ask you, what is your favorite team or what team do you support? Yes. And you can mention the team that you support. Yes. And in fact, if you are supporting the best team in the world, which is Barcelona, then you don't have much problem. You know that. So yes, this is something that you should talk about. You can also talk about your hobbies. You know that. Yes. So this is about yourself. Anything that you think will put you ahead of other people, you should say it in this interview. Now, aside talking about yourself, what are some of the things that they can ask you about you? Now they can ask you why you pick medicine or why you want to do dentistry. This question is something general. They are going to ask everyone. I mean, you are coming to study a course, so definitely you have to know why you picked this particular course. And this question should be something that you should be expecting. Now, when you ask why you want to study medicine, the last thing that should come into your mind is passion. I mean, passion is out because passion has been a constant answer they've been giving since 1980. So you will not be the first person coming in to tell us that it is your passion. So when you are coming in and then they ask you such a question, passion should be out of your mind. You shouldn't even mention passion at this point in time. Let's say you are asked to mention 5 reasons, then maybe passion can be the last thing you talk about. But if you are asked to just give a reason, you can give 1 or 2 reasons, and that is all, just in case you are not giving a limited or a fixed number of reasons to give. Now, what are some of the reasons you can give? I will need you to do this exercise. Just after this video, try to Google the patient to doctor ratio or doctor to patient ratio in this country. In this country, one doctor is to 6,000 patients. That the last time I checked, okay, that was in 2024. One doctor is supposed to take care of 6,000 patients. And if that is the case, in order for you to, in order for the deficit to be filled or for other people to get into this profession, you decided that, well, this there is a lot of deficit here, and you would love to become a doctor to be able to solve this kind of deficit problem in the country, which is a very good reason why you want to become a medical doctor or you want to become a dentist. In fact, the dentists are even less. Okay, so if you're a if you are applied for dentistry and you are asked such a question, you should try mentioning the dentist to patient ratio, which is very very huge. I think it will be around 2024. It was 1 is to 50,000 or 60,000 patients. So yes, you should make your research concerning this, and then when it gets there, you'll be able to give such a good answer when you are asked. Now, you can also talk about the social values attached to the profession or being a doctor. You know, a doctor is someone who is being respected in our society, and we all know that, right? So it will not be a bad reason for you to say that you want to become someone who is being respected in the society, or you want to be among the people that are being respected in the society. So telling them that the social values attached to being a doctor is what encourage you to become a doctor is also not a bad reason for you to become a doctor. Now, you can also talk about uh, many specialization fields that are in dentistry or that are in medicine. Okay, when you're coming to study medicine, you say that there are a lot of fields that are in medicine that you feel like after studying medicine, you have a lot of choices to choose from which one to specialize, you see. So that is a great reason why you want to become a doctor. Now, when you mention such a thing, okay, then you should have in your mind that the next question that will follow is, what are some of the specializations we have in medicine, or what are some of the specializations we have in dentistry? So yes, you should be able to know these things. You should know these things because you should know the specialization or the fields that we have in medicine or dentistry. It will help you to answer such a question when it's a follow-up question. And if such a follow-up question comes and you're able to answer it, it actually boosts your score. So I'll advise you to read on that. Now, these are some of the major reasons why you want to become, or someone will say, I want to become a doctor. You can also tell a story. You can tell a story where you witnessed something in the hospital that encouraged you to become a doctor. You can say maybe you went to the hospital where you realized that there was this patient that came with the relative, okay, but the relative was in a on a stretcher where he was almost gone, and then a doctor was able to save him. And I mean, when you saw how the relative behaved towards the doctor, how the relative became so relieved when the doctor came to tell the relative that, oh, your relative is safe, or your brother is safe and he's not going to die. The smile that the doctor gave that woman was actually something that encouraged you to become. This is something like this is like you telling them a movie. I mean, it's not bad, but if there is anything at all, you should try talking about the ones that I mentioned first before going to such a story. But if you have a solid story, if you have something that have encouraged you to come into this profession, you can tell them about it. Now, what other question can they ask you about yourself? They can ask you, what makes you a better candidate than other people? Why should we pick you over other people? And this is a very important question. This is where you tell them about your qualities, okay? This is where you tell them about things that you feel like you are very good at. And you can start by saying that you don't see yourself better than other people, but you feel like there are some things that make individuals special from other people, and you believe that you possess some qualities such as good communication skill. You believe in teamwork. You believe that togetherness makes brings more satisfaction than a single person doing it. You can tell them a lot. You can tell them you are time conscious. You can tell them that you believe that proper preparation actually leads to perfect performance. So anytime you want to do something, you take your time to prepare very well before doing the thing. These are qualities of someone who wants to become a doctor. These are qualities of someone who they would like to pick over other people. Tell them something that makes you special. Tell them something that will make them pick you over other people. This is the point where you showcase that, yes, you have this within yourself. So, yes, tell them how empathic you are. You should know the difference between someone who is empathic and someone who is, say, uh, someone who is empathetic and someone who is sympathetic. Okay, when you are empathetic, you try you show, like, you put yourself into the shoes of other people. And then when you are sympathetic, you feel pity for other people. As a doctor, you are not expected to be, you can be, uh, you can show sympathy towards people, but you are expected to be empathetic. So you know how other people are feeling. That will affect how you care for people. So these are some of the reasons why they should pick you over other people. Now, that is about yourself. These are questions about yourself and how to tackle them. Now, let's look at some of the community contribution questions that they might ask you. First of all, they will ask you, what contribution have you made towards or your community, or what 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 have you done to help your community or where you stay. This is where the positions you held back in school counts, okay? I mean, school is a community, right? So if you were the school prefect, if you were the organizing secretary, whatever you were back in school, you actually helped in doing something, right? So you tell them about positions that you've held before. If you've held any position in church, or if you are holding any position in church, you tell them about your position in church. These are things that are achievements, but sometimes we don't consider them as achievements. Tell them tell them about this achievement, and then it will help you to 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 be picked. Now you can also talk about your church doing health screening some time ago. Well, this might not be true, but I mean, this is interviewing. You are saying anything that will help your selection process, right? So yes, I would advise you to talk about your church doing some blood donation and you were able to do the blood donation. You can also tell them about some communal labor and that you held in your community and all of those stuff. Now, let's say you are staying in cantonment and you are coming to tell us that you did the communal labor. Where did you go and read? So this you just when you are I'm not encouraging you to lie, but when you are lying, you should know how to go about your lying. So yes, these are some of the things that they might ask you concerning the community contribution. Now let's look at some of the ethical issues. Most of the questions will come from this angle. Most of the questions will come from ethical issues. So they are going to be like scenarios or stories, and then they are going to expect you to give out a perfect answer over here. So let's say the first question will be like, let's say your father or your mother asks you to to give him or her a fake doctor's report. She needs it or he needs it for something urgent. What are you going to do as a trained medical doctor or as a dentist? What are you going to do? Now, this question is not about your mother or your father. This question is not about who is involved. It's an ethical question. They want to know that are you going to hold your ethics to the highest standard? So yes, see, my mom, my dad wants a medical report, but they are not sick. So what am I going to do? I can't give them the medical reports. It is not possible. So this is a straightforward answer. No, you are not going to give them the medical reports because such an act is illegal. So you let them know that it's an illegal act, and then you can't give your mom or your dad a fake uh, medical report. Now they can also ask you that uh, you let's say a patient comes to the hospital and you prescribe a drug for the patient, a very expensive drug. Yeah. Now you realize that the patient wouldn't be able to afford that particular drug, and you know that there is a cheaper option. What are you going to do in such a situation? Are you going to no? And let's say sorry, let's say you know of cheaper option, and your superior is telling you that even though you know of cheaper options, do not tell the patient about the cheaper option. What are you going to do over here? Now, they are trying to put you in a situation where your superior is telling you a different thing, and the right thing, the right thing is on the other side. So are you going to obey your superior or do the right thing? Now, what you have to know over here is as a doctor or as a dentist or as a medical doctor, your core value is to take care of the patient. Your core value lies in the health of the patient. So you consider the health of the patient or the care of the patient above any other thing. So, yes, how are you going to answer this question? You are going to answer this question by saying that as a medical doctor or as a dentist, your work, your core value is to take care of the patient. Your core value is to make sure that the patient is healthy. And how are you going to make sure that the patient is healthy? If this patient does not buy the drug, then it means that you have not performed your core value as a doctor. If that is the case, you tell the patient or you ask the patient, you tell the patient about the cheaper option, or you ask the patient to go and buy a cheaper option drug. This is a perfect answer. There might be a follow-up question where they will ask you if this is not a disrespect to your superior. You have to let them know that you are just obeying the law and you are just doing what is right for the patient because the patient's health or the care of the patient is your primary value. So such a question can come in and then you need to be able to answer. Now, there is something else they can also ask you about. Let's say there is something we call mercy killing. There is something we call mercy killing. In Ghana, let's say you go out there, okay, you are practicing in the hospital, and they bring a patient in, and this patient is so sick. This patient is going through a lot of pain. This patient is at the end point of his life, and the relatives of the patients are asking you to give a drug to the patient for him to die. For him to die in a sense that when the patient die, then the pain will go away. If you are a doctor or if as a trained doctor, what are you going to do in this situation? Now, you have to know that this is something that is being practiced in other countries, but in Ghana over here, mercy killing is not allowed. Mercy killing is something illegal. So you have to tell them that no, you cannot do that because that is illegal in the country, and that is not something that we can practice in the country. It's a simple answer. You just have to know whether the action is legal or illegal. They can also ask you that, let's say a pregnant woman comes to the hospital, and this pregnant woman is telling you that already have she already she's already having let's say uh, 5 children, and this sixth child in the womb, she doesn't want to keep it, but the husband says she should keep it. So she's coming for an abortion. As a trained medical doctor, what are you going to do in this situation? Or as a trained personnel, what are you going to do in this situation? Now, you also have to know whether abortion in Ghana is legal or illegal. One thing that I would like to tell you is that abortion in some situations are legal and in some situations are illegal. In a sense where a patient is or someone is being raped, or in a situation where a child that is in the womb will suffer a lot of abnormalities. In this situation, abortion can be legal. But in this situation where this woman is coming in without being raped or without a child having any uh, abnormality in the womb, it is illegal for you to perform abortion. So yes, the what you have to know over here is whether the practice is legal or illegal. If it's illegal, then you cannot perform that particular procedure for the patient. Now, let's say they ask you that in this situation, what are other options that you advise the patient to embark on? You tell them that normally we have people who are ready to adopt children. We have where they keep children that people come in to adopt them. So you encourage this particular person to give birth. And then after giving birth, they can give out the child to anyone who is willing to adopt the child legally. And this, I think, will be one of the good answers you can give in this situation. Now, a lot more questions can come in this form. So when you are asked these questions, what you need to know first is you need to ask yourself whether what they are asking you is legal or illegal. Then from there, you can be able to answer. You will be able to answer the questions perfectly. Now, I remember when I went for the dental school interview. Well, we did something where there was a bowl with a lot of papers where they had questions on the paper. So you just dip your hand into the bowl and pick one of the questions. Then I picked one of the question, and then my question was, you were absent, you were in the house, and then a patient comes to the hospital. When the patient came to the hospital, uh, the nurse in charge called you in the house and told you that, okay, you have a patient. The patient wants to perform a particular procedure, but here lies the case, you are not around. But a nurse who you have worked with for 15 good years is around, and he or she will be able to perform that procedure for the patient. What are you going to do as a dentist? What are you going to do? Are you going to tell the nurse to do the procedure, or what will be your moves? And this is also another thing to test your knowledge on ethical issues. If the procedure the patient is coming to do is your duty to perform, then you cannot give such a duty to the nurse to perform. A nurse working with you for 15 years doesn't make the nurse a dentist as well. So what you have to do over here is to tell the patient to wait for you, either wait for you to come, or if the patient cannot wait, or if where you are is far and then you cannot make it on that day, you tell the patient to book an appointment to come and see you on a particular day that you will be present. So this is an answer that they will be expecting you to give. And I think this is something that shouldn't be so difficult for you to answer. So any ethical question they will ask you, first of all, ask yourself if that particular practice is legal or illegal. If it's legal, you can perform it. If it's illegal, you should not perform it. Now, let's when we talk about the general knowledge question, you need to know about the current happening. Okay, the most important thing that is affecting us right now is galamsey. So you need to know the effect of mercury and lead on our health. So they can ask you, what do you think are the effects of mercury, or what do you think are the effects of 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 lead on the human body? This is something that I will encourage you to read about. So when you come and then you are faced with such a question, you will be able to answer it perfectly. Uh, the last aspect of the question can be about the profession. Okay, they can ask you about the profession that you're coming uh, to 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 study. Now, let's say the the only question that I remember that was asked concerning uh, dentistry was, what are the specialization in dentistry? Okay, what are the fields in dentistry? And this came as a follow-up question to a question that I answered. So yes, it should be something that you should try and then read about. I can't remember that particular question. I wasn't able to answer, but yes, they are not expecting you to be perfect in your answers. They are not expecting you to get every question correct. What they are expecting you is to come in with a lot of confidence and should be able to answer most of the questions. So yes, if you are not able to answer a question previously, don't let that affect your next question. You should be able to be confident to answer the next question. If you are not able to answer a previous question, that should even be an encouragement for you to answer the next question perfectly. So this is something that they might ask you about the profession as well. Now, these are a lot, and I hope that you've taken note of these things that I've said. They are going to help you during your interview. These are very, very important points that you need to take into consideration when you are coming for your interview. At this point, I will plead with you to subscribe to my channel, hit the like button, share this video with any other person that you know that is coming for the interview, for them to know about these things, for them to learn some of the things that will help them during the interview process. Thank you for staying around for this long period of time just to watch me and learn something new. I wish you all the best. I wish you greatness. Come in with all the full force and come and do great. God bless you and stay blessed. See you next time. Bye bye.